Hello, my name is Ana-Marija Hristovska. I am an anesthesiologist and a PhD student from Copenhagen University Hospital, Hvidovre in Denmark. And I am interested in postoperative orthostatic intolerance. So in this particular study, we looked at the incidence of postoperative orthostatic intolerance after total knee arthroplasty. A bit of background to begin with. Early postoperative mobilization is, of course, a key concept in the DRS pathway, but it can be hindered by postoperative orthostatic intolerance. And these are the symptoms of dizziness, nausea, vomiting, visual disturbances, feeling of heat, or even syncope when the patient goes from supine to standing position. And this is, of course, not good because it increases the risk of fall, risk of postoperative complications, as well the in-hospital length of stay. So the aim of this particular study was to look into the incidence and the pathophysiologic hemodynamics of this condition after total knee arthroplasty. And in order to do that, we enrolled 45 patients that had 3 measurements, a preoperative measurement and then 2 postoperative measurements at 6 and at 24 hours. During the measurements, the patients were mobilized, so they were supine, sitting, and standing in 3 minutes in each position, while we did a continuous non-invasive hemodynamic monitoring using LIDSCO. So what we found out was that at 6 hours postoperatively, 44% of the patients had at least one symptom of orthostatic intolerance, while 10% had severe orthostatic intolerance, which means that they could not complete the mobilization procedure due to intolerable symptoms. And at 24 hours, the corresponding numbers were 22% and 5%. So we also looked at changes in hemodynamic variables during the mobilization. Here I have selected the systolic arterial pressure, heart rate, and cardiac output. And what you can see is that both patients with orthostatic intolerance, which are the yellow lines, and patients with severe orthostatic intolerance, which are the red lines, had attenuated responses. There were no significant changes in other hemodynamic variables, and there were also no changes in other perioperative variables such as bleeding, fluid balance, opioid usage, or pain during mobilization postoperatively. So we conclude that the incidence of orthostatic intolerance after total knee arthroplasty is 44%, and it is related to attenuated cardiovascular responses. Thank you very much for your attention.